Nobody works toward the preventing of a disease.
That you can prevent diseases before they occur.
Preventive healthcare is also divided.
If somebody is having diabetes or hypertension,
Even if you have a condition, it's not.
so it's very important first to prevent pressure source.
Yoga or gym, what would you choose?
Anybody over the age of 40 or
You know, in India, 80% of the diseases can be prevented, but nobody works toward the preventing of a disease. And we have worked a lot towards the prevention of diseases, and that's where we play a role. I'm Dr. Hema Sathish, the founder of Cureka, and here we have Dr. Sathish Devadoss, the co-founder of Cureka. Hello.
Hello. So Cureka is a preventive health platform which is accessible for everybody. And our goal is to prevent diseases and not to complicate things and let it go for a later stage.
So we are trying to flip the 80% of the diseases which can be prevented instead of being cured. Cure is the first thing which we think about. So when a disease comes, we run to the doctor. But why not take care before we even get the disease? So what do you think preventive healthcare would mean?
So absolutely, preventive healthcare actually means that you can prevent diseases before they occur. So that is the most important thing. This can be done by doing regular screening, leading a healthy lifestyle, detecting diseases before they become full blown. So all these can lead to better treatment of these patients who have any diseases.
Yeah, we should include avoidance of injuries as we age, not only as we age, but at times, you're very active and you're doing something and you're risking it a little more. Then that time also prevention can help you from a
Exactly.
fall or from an injury, right?
Exactly. In the young sports person, the sports person should do proper warm up, proper training so that he can or she can prevent injuries. And then for the elderly people who have frequent predisposition for falls, they should do some core exercises, strengthening, as well as see any risks of falls which can lead to fractures or conditions which can be very painful. So preventive healthcare does not mean only doing blood tests. It means that a whole gamut of things, right from preventing injuries to preventing illnesses.
Well, and preventive healthcare is also divided as a primary prevention, then there's a secondary prevention, and then there's a tertiary prevention also. So, would you like to talk about the tertiary prevention which comes in? Because, many a times what happens, we believe that, oh, I become a diabetic, so I should take lesser of this, that, and all. We are aware of it, but nevertheless, we do not want to implement it many a times because we don't probably think of the complications which will come in soon. But what else there are many other diseases like that, right?
So tertiary prevention first is to diagnose the condition correctly, then make sure the condition is under control. In fact, if somebody is having diabetes or hypertension or any other non-communicable disease, you have to make sure that the condition is under control. So this will prevent this disease or this condition which may lead to further complications. So preventing the complications is what is called as the tertiary prevention. So it's very important that in these conditions, we need to make sure that the person suffering from this disease has his regular checkups, make sure he or she has a regular, a healthy lifestyle, and make sure he or she will prevent these complications which can occur and which can make things very very, very bad for them in the future.
Well, when you talk about diseases, we are talking about some diseases which you can help, like prevent or make help yourself from making it worse. But then there are some conditions, very sadly, that sometimes it's very debilitating. So if you have had a stroke and they are on bed for a long time, so preventive healthcare helps there also, right? So there is a lot of prevention over there also. So what can be done when something like that comes up?
Yeah.
So.
So, in a person who is bedridden, it's very important that all his or her joints are mobilized. If they lie on bed for a long time, there is an increased risk of deep vein thrombosis, which means that the blood can clot in the veins in their legs. So you need to prevent this. It's a very serious complication. If that blood clot moves out from there, it can go to the heart or brain and become life-threatening. So you need to prevent it. How do you prevent it? By regularly moving the joints, by regularly moving the foot and ankle, and also by using preventive stocking devices, which can also help in reducing the chance of deep vein thrombosis. Similarly, patients who are bedridden for a long time, they can also get what is called as bed sores, which are a pressure sores. So it's if they lie down in the same position due to pain or due to inability to move for a long time, it is mandatory for the caregivers, especially at their home, to make sure that they move the patient either to the sides or to make them change their position so that there is no pressure sore developing. If a bed sore or a pressure sore develops, it becomes a really big problem. It can get infected, and the person who is having this debilitating condition can lose a lot of protein, nutrition through these wounds, and it's going to be a pathetic life after that.
See, well, even if you have a condition, it's not necessary that you succumb to it and then you think that that's the end of the road. No. So how do you? Everybody is bold. They try to fight back, but at times you miss out. Like you're not having your right proteins. You're not doing your proper exercises. You're not using the preventive measures which you're supposed to use. So if you can tell something on those, like what are things which they can use and what we could curate for them to prevent, uh, getting worse from what they are.
So, in debilitated people who are on their bed for a long time, so it's very important first to prevent pressure sores. That you can do so by using these air beds and also changing the position of the person very often. Encourage them to walk, do adequate physiotherapy. You can request a physiotherapist to come and do physiotherapy and make them walk. So that is very important. And second thing is the kind of nutrition they are getting, because most of the time, to avoid going to the toilet, these people will start taking less food
Oh, that's
and
sad.
less fluid. So this becomes a problem, and they start taking less food and fluid just to avoid going to the toilet. So there the nutrition comes down, and when they become weak, they can get any other diseases like pneumonia, they can get urinary infections. All these problems can come if you are debilitated and your loss of nutrition also. So here, to prevent all these, a proper nutritional guidance is required for people in the debilitated state.
So we've spoken quite a bit about preventive healthcare and quite a few angles which people don't think in. So that's something which we have spoken about. But I was thinking about, what are the misconceptions about preventive healthcare? Because when you talk preventive healthcare, they say, I mean, everybody, the first thing which pops in their mind is, taking multivitamins. That's fair enough. It's good enough also. And then if they are a little more advanced in their thinking, then they think about immunization. But I have yet to meet somebody who can think about something more than that, or thinking about intervening in conditions where they've already developed a problem and how to prevent further and all those things. So there are a lot of misconceptions
Yeah.
about this, right? So you
So
want to
the
think about
first
it?
misconception I would say is that preventive healthcare is for elderly is the biggest misconception.
Yeah, that's true.
So preventive healthcare starts from as you're a child, because many older women, they get something called as osteoporosis, which is weakening and thinning of bones. This bone is like a bank, and you have to develop the bone stock with your deposits of calcium and protein and
And
minerals.
that's the orthopedic surgeons
Yes.
talking.
From a very, very young age, right from your second decade onwards, you need to build up these bones. So it's very, very important to, right from young age, your preventive health starts. Similarly, as we have told earlier, preventing injuries in youngsters also is very important. And once someone gets a disease, it's very, very important to not to make this into further complications. So you need to prevent the progress of this disease. So it's very important that it doesn't go into other complications of the disease. So the first misconception is, I think, the age.
Okay. Well, I'd like to highlight one more misconception along with this is, social well-being. Don't you think social well-being is very underestimated? In today's world, people just feel, social well-being is being on social media. No, social well-being is how you interact with people whom you are with or around us. So that's very important is what I think. I hope you also agree with it, right?
Definitely. Social well-being is today very important because people are always buried in their cell phones or their computers. It's very important for them to interact with other people. Please carry on with your thoughts on social well-being.
And not only that, mental health. Yeah. So it's when you talk about holistic prevention, then these are something which we have to bear in mind. So it's not only about, avoiding a fall or avoiding some other problems which could come in the future, which you can foresee or think, but this social well-being is also mandatory because that's like overall development of you. And that is going to, keep you fit quite a bit because mental health is very, very important. You must be also having patients, right, who if they're not mentally well, then they come up with a lot of physical problems also.
Exactly.
Yeah.
We call them as psychosomatic illnesses, where there is a underlying mental health issue. I won't say they are crazy, but it just says that due to stress, these pains also get amplified. Most commonly, this neck pain and low back aches are very common areas of these psychosomatic disorders, where nearly 25% of the pain they express is due to stress.
But I think when they're stressed, they're trying to hold your muscles also tightly. If you have observed, like when you're very stressed, all your muscles are also held very tightly. So maybe that is because of that also the pain can reflect.
Yeah, there is a
And
lot
then
of
there is
chemical
amplification.
changes.
Yeah, there is a lot of chemical changes
in
inside
the
your
body.
system. Yeah. And then apart from this, you tend to feel it is amplified because obviously your focus is on something which is going to make you feel better. So probably when you get some attention, you feel nice. So there's nothing wrong in it, but nevertheless, that is one aspect which you can avoid. So prevention should be in that aspect also.
Yes.
That was just one of the aspects I thought of.
So what do you think is a better way to prevent this kind of stress?
Social well-being means having friends. I feel vitamin F is very, very important. That is friends. So you should have friends always, any given point of time. And I think parents also should encourage because today's children, it's very difficult, as you and me also we are seeing. Like kids find it very difficult to make good friends, And so from as parents, we should also encourage that, I guess. So I think I have done a little bit of that with the children. And when they have their friends and when they want to have the time with their friends, I do demarcate the time and say, no, you should be with your friends at this point of time so that, in future they have somebody to fall back at, somebody to talk to. Because even if parents are there are some things they don't share with us or we don't share with our parents either. So,
Yes.
That is.
So I think meditation and yoga can be a big stress buster.
Yeah.
And definitely if they do these two, I feel in the long run, their usage of medications and it can prevent the progress of the disease. So I think these meditation and yoga are great exercises for the brain.
Yeah, true.
And for the mind, so which will prevent stress.
So I would like to know if you would say, like, if somebody has to keep fit, so you choose yoga or gym, what would you choose? I mean, and you have to, of course, tell me, I mean, tell me
Yes.
the reason for both of them.
Yes. People over the age of 50 will definitely, young people will go to gym, they pump iron and things like that. But actually, people above the age of 50, they need to go to the gym. Because after 50, they develop something called as sarcopenia, which means there's muscle wasting. The
I think that's
muscles,
very much overlooked, right? As you
yes,
age, people don't realize it. People
think
think
about
it's
it
just
at all.
age and it's bound to happen. So this
Yeah,
is also one aspect of prevention which you can really look
correct.
into.
So to avoid sarcopenia, because sarcopenia in turn will lead to weakness of bones,
Yeah.
in turn it can lead to frequent falls, in turn it can lead to fractures.
Oh, oh my.
So this is a very vicious cycle. So again, people above the age of 50, I would recommend them to do resistance training, that is lifting weights and going to the gym
Yeah, but a word of caution, right? They shouldn't do it suddenly, and too much of weight is also not good.
under a proper
Yeah.
trainer guidance.
Well, health checkups are another one thing, right? Everybody is now aware and they do their health checkups regularly. And I think many companies also promote this a lot more, and they help their employees do their blood tests and, I mean, regular checkups and everything. So, in your, this thing, I mean, generally, like how you see, observe in the hospital or what is set in the hospital, would you like to speak about how often the health check should be done? And there are some special checks which should be done specifically for men and women. So, a little bit on that,
Mm.
maybe.
Right. So anybody over the age of 40 or 45, I believe, should have a health checkup every year.
Okay.
Basically, we can see that most of our people are now having a very sedentary lifestyle.
Yeah.
Sitting is new smoking. So if you're sitting for a long time, your body becomes completely not doing anything and you're going to have. So it's a new smoking is sitting.
Okay.
So you need to have a healthy lifestyle. So for that, so to make sure that you do one health checkup every year. For men and women, maybe slightly different.
Okay.
Women are more prone for cancers of the breast and cancers of the cervix. So women should have probably a pap smear also on a regular basis. And regular self-examination of the breast by women can be done by themselves. But apart from that, they can have a mammogram, or less invasive is an ultrasound mammogram, which can also detect early stages of breast cancer, especially if they have cancers in the family. So it's very important for women to check these two also, and preferably once a year is a very good thing. Apart from that, women, as we discussed earlier, are more prone for osteoporosis.
Yeah.
So they should, after 50, they should probably have a DEXA scan, which is a bone scan, which will tell about the density of the bone. So that will help us to know whether the bone is weak or not. And then if it is weak, then we can ask them to undergo some treatment to make the bone stronger. So if it is very weak, then there is a very, very high risk of fractures. And osteoporosis is a silent killer. The first symptom of osteoporosis is a fracture.
Oh,
So there is no other symptom.
that's very bad.
Very bad. So, and very painful.
Yeah, it's very painful.
So
The
that's,
bone takes a long time to heal, especially if
yeah,
it is having osteoporosis also,
exactly.
right?
So it's DEXA is a 5-minute test
Yeah.
every year for every woman, should be done after 50, after menopause.
And some things about men also.
Men should have a prostate check regularly. After 50, they should have frequent abdominal scans to make sure the prostate is not enlarged, and also a surgeon can check whether the prostate is enlarged or not. And there are some blood tests which can detect prostate cancer, so which are very unique with men. Prostate is a gland which is just below the urinary bladder, which can cause cancer, and men can get this. And above 50 also, if possible, men can also undergo colon endoscope or a colonoscope, which will also show if there is any intestinal cancer. So that can happen once in 2 or 3 years.
Like, that's a lot of information. I have now slipped into the preventive healthcare zone, and you are in the tertiary healthcare zone more. So I would like to know, what would you advise? I mean, what is more cost saving, preventive health or tertiary healthcare?
Definitely preventive health.
Any day, right?
Definitely preventive health. Tertiary healthcare is expensive, it's painful,
Yeah.
and it can lead to many complications.
Yeah.
So definitely, if you can avoid all these things at a very early stage, you are going to save money, save a lot of pain.
Smart living. So I think like investing in shares or in your better future in terms of financial status, I think we should invest in health also, right? So we
Most,
should take care.
yeah, health is wealth, has been put forward early. So health is wealth, and definitely you should invest in your health to make sure your body can run a long life without major issues. So it's very important that you invest in your health.
And I've also seen, what happens is like you're very healthy, but then suddenly you develop a problem. Then it does pull you down a few steps. And then how much ever you try to pull yourself back, then there is a little bit of a constraint towards many things. So at least, if not many, few things. So I think that time also prevention takes its role and pulls you back again. Like you can do a lot of exercises, physiotherapy. There are so many equipments available. There are so many ways to take care of yourself. So, and as I always believe, whatever happens, you have the right to live it really well. And you make the choice.
Correct.
So that's very true. Well, if you have to see in the Western world, preventive healthcare is so much seeked for, and I think people. I think it's the healthcare system which works like that, right? Because for them to avail healthcare, it's very expensive, and so they want to treat. They don't want to get into that and try to help themselves as much as possible. Try to keep themselves, I mean, they do not want support from others, so they're very independent that way also. So, what is the biggest stumble block or the roadblocks which we have in India, which is stopping us from taking preventive healthcare as a first step of action?
Correct. So, first, I would say preventive healthcare, there is no awareness in our country.
Yeah, that's true.
So, lack of awareness is the major factor, the major stumble block. When we say that you should do regular checkups, you should meet your doctors, get adequate awareness of your disorders. If any familial disorder is there, you have to do things. People think that hospitals and doctors are making money, but it's not so. It's your investment in your own health which is going to take you a long innings in your future. So awareness, I think, is the most important part of preventive healthcare. The second thing is socioeconomically, people may not be very well off to do these tests on a regular basis. So I think government has come in and they do have master health checkup now available in the government hospital also, especially in Tamil Nadu. And I'm sure people can avail these facilities for no cost at all. With the good quality nowadays in all the government hospitals also. So I think that again should not be a barrier. So my only point is here awareness. People should be more aware that health needs to be checked regularly and you need to do preventive checkups regularly so that you would avoid getting diseases or the progress of the disease. So you see, even for our cars and two-wheelers, every 2 or 3 months you're servicing it. Or when that adequate kilometer runs, you're servicing it. So when even mechanical vehicles need service, your body, which is like a fantastic vehicle developed by God, needs servicing regularly. So that is your preventive health checkup.
That's a nice way to put it, or a very crude way to put it, I guess.
Being an accomplished dermatologist, Dr. Hema, you have been asking me a lot of questions about orthopedics and other things. So, how do you think the skin problems can be prevented?
Well, to begin with, my first I always keep saying this: don't overdo things. The youngsters look at all the reels, look at everything, and then they want to apply whatever comes to their mind and whatever they feel is right for them. So don't you know choose without having the correct knowledge about things. So that would avoid a lot of complications and a lot of problems on the whole. And then some diseases which are like autoimmune, which I see a lot of them now, and because of sun-related problems, although there are some diseases and all. So those you can do by sun avoidance or taking care of yourself well without getting yourself like burnt out in the sun. Sun exposure is necessary for vitamin D, but nevertheless, you needn't go and blaze it out in the sun. And then apart from that, this autoimmune diseases, which I see quite often, is because the younger generation is following a lot of fancy things, and they do not take up things which are actually very easily available. That is, the natural food which is available, especially in India. We have abundance of that, but I think that is avoided a lot more, and the youngsters are looking at more fancier things to eat,
Processed
drink.
food
Yes,
and
yes, yes.
processed sugars.
Yes. So if that can be avoided, there's a whole load of skin problems which can be avoided. Yeah.
So, according to you, can you give some tips to our listeners how you can have a good lifestyle and prevent illnesses?
This is a basic thing. Stick to timings more. Like, having a schedule is out of fashion nowadays. Saying that I was up late in the night, so I woke up late today, I'm just going to sleep extras. All that sounds good. It's fine once in a while. But then I would say that have a schedule most of the times, at least,
So,
if
the
not all the times.
circadian rhythm
Yes,
of the
yes.
body.
The circadian rhythm of the body is very, very important because, that sets the clock for so many hormone secretions, so much of your cell rejuvenation, and so much of your mental health to be, functioning well. So, with all that, that would help a lot. And then, apart from that, diet. Diet is the biggest thing. Diet is something I would point blank, if you have to say, try to stick to the local food which is available, and try to listen to your mom who says eat healthy, or or your grandmother's diet would be the best thing to follow, is what I would like to say. And with all that, I think it should be. And then physical activity. Schools nowadays don't give any physical activity. So there are many conditions like obesity leads to a trail of diseases. And that is thanks to no physical activities in the school. So school is not only for studying, it's for overall development. So that has to be also looked into. And there should be some kind of activity. And I feel that young kids, they all say, yeah, I joined the gym. So I always tell them, don't join the gym, play something, because there should be some game. So
Overall
yeah,
development.
overall development. So that mentally also helps, physically also helps, and then at the same time, you're playing with somebody else, so you're interacting with somebody else, so you're making friends. So
Social
so
connect.
social, your well-being
Connect.
is also better. Your social connect is going to improve a lot more. So there are so many things if you just live a simple life.
I think adding to your points, for a youngster, for a young adult, I think avoidance of alcohol
Yeah.
and total abstinence from smoking. I think these
Yeah.
are two important lifestyle modifications they have to keep in mind to prevent illnesses.
And vaping is worse than smoking. So
Right.
that's also not acceptable.
So these kind of ill habits, I think, should be avoided by the younger generation.
And they're going to hate us for this. There are some myths. So I'll ask you now. I'm young, so I can recover real fast.
If you have the right nutrition and if you have the right kind of treatment, you can recover.
That is not true always.
It's not true always.
Well, healthy food is expensive.
Need not be. We have now so many health stores, even in villages. Now you can get all the cereals, millets. All these are
Yeah,
very
cereals.
healthy.
I don't think you're talking about cereals. Like,
Not the boxed
the branded
cereals.
box ones. Yeah.
No, this I mean to say the millets and this dal and other things, so that it's definitely not expensive. If you eat the right kind of food, it's definitely not expensive.
And the local fruits are absolutely great all the time. Yeah.
Yes, fruits and vegetables definitely are very good.
Gym is equal to good health minus ignore sleep, food, mental health, everything. True, false?
Definitely, the other parts should be a plus. Good sleep, good diet, should be a must for everybody's life. Gym can be an added benefit, like I told, in the elder age group as well as the younger age group.
I don't feel sick, so I'm healthy.
Need not be. Like I told, there are a lot of silent killers. So you need to check regularly your heart, your bones, your other functions of your body like liver. One silent killer is a fatty liver,
Yeah.
which can go on to become cirrhosis. So there also you may not know the symptoms till it goes to the third stage.
And it's quite common, and people think it's just fine. Oh, I have a fatty liver, so they don't. I don't think they realize the significance
Yes,
of it.
it's a very significant disease and a burden for the country right now.
Multivitamins can replace meals.
Definitely not. You need a balanced diet. Multivitamins are part of it. The food itself will contain a lot of vitamins. Multivitamins can be supplements. When people, like elderly people, cannot digest many foods, cannot be able to absorb those vitamins, there can be supplements, but it cannot be a replacement.
And I think fast-paced lifestyle also, at times you're not able to catch up with all your dietary needs, then supplements do help, right?
Correct.
Only overweight people have lifestyle diseases.
I have seen many young and thin individuals who are probably a famous movie star also was working out in a gym and died of a heart attack.
Yeah, that's
So
sad.
it's a myth. So anybody and everybody should have regular checkups. It's not only the obese; it can be any healthy looking person also. Until unless you check your body, you will not know the disease.
And there was once I was reading an article like, somebody died really young. He was very fit and he used to keep track of everything about himself and lived a very lovely life. But stress was very high and sleep was very less. So, yes, that can also be a killer, right?
Yeah. So these are lifestyle disorders.
Yeah. So these also come under lifestyle disorders. So thin doesn't mean fit. Okay. Sweating equal to fat loss.
That you should answer.
No, not at all. Sweating, I mean, sweating is from the glands which are way above the fat cells. So, you don't sweat out fat. I wish I could actually, but then it doesn't happen. That's not true. Many people believe that, when I'm ready, I'll start, or when the time comes or the necessity comes, I'll start taking care of myself. So, what's your take on that?
So the necessity is there from your childhood. You need to take care of your body, your mind, right from childhood. So there is no time expiry date on your body or anything. So you have to definitely start at a young age and regular checkups with your physician, even in school, even in the colleges. All this will definitely help. Especially we see a lot of young girls with the decreased hemoglobin. It's a big burden in India, reduced hemoglobin and anemia. So there is no age limit.
And earlier, anemia and lesser hemoglobin was because of,
Poor
people
nutrition.
bad nutrition. But now it's finicky nutrition, I think.
Exactly. Again, it's poor nutrition. It's not due to less money.
Yeah.
It is due to bad lifestyle.
If something is labeled organic, then it's healthy.
If it is organic, it definitely means that there is no pesticides in it. So I would think it is healthier than the regular food sold. Because nowadays, we all know that to increase the yield, farmers and agriculture use a lot of pesticides.
Yeah,
and
many
also,
chemicals also.
chemicals and to increase the yield and increase loss of the
Crop. Yeah.
crop.
Mental health is only about stress.
Stress is an important factor in mental health, but it's not all about mental health. I think physical health also makes a lot of difference to your mental health. If you're not well, if you are suffering from disease, then definitely it will affect your brain also. You will feel that I'm not able to do this, I'm not able to do that, and things like that. So it's not only stress, it's physical health also can affect the mental health.
Okay. Skipping meals helps in weight loss.
This is my favorite subject. I believe in intermittent fasting.
Yeah.
So skipping meals, or you would rather say you increase the gap of your meals, will lead to something called as autophagy, where the body will try to burn away all the fat as well as the glucose, and the insulin resistance is better. If you are able to skip one meal and have a break, give a break to your body for more than at least 12 to 14 hours, then you can start losing weight.
Yeah, it works for many, but doesn't work for some, I guess.
Yes.
So maybe it's a personal choice.
But it is a scientifically proven
It's
fact.
scientifically proven, but many people are not able to do it because of varied things like I'm not able to follow it at all. Gastritis and stuff like that. Yeah.
So we believe that preventive healthcare is the future of medicine. With the right tools, we would like to make sure that each and every individual is empowered to take the correct decision on his or her health with access and knowledge of preventive healthcare, so that healthcare can be more of proactive rather than reactive. With reducing the healthcare burden on the country, the society can definitely improve, reduce costs, and also the overall well-being of the country will be much better if you prevent diseases and have a healthy lifestyle.
To build a stronger nation, we have
Definitely.
to have more preventive healthcare in place. That's nice. Well, very well said.
Thank you.